In a world where convenience often trumps quality, the truth about our food choices is more alarming than ever. Despite consuming the same number of calories, men eating ultra-processed foods are putting their health at serious risk, and the consequences go far beyond weight gain. But here's where it gets controversial. Could these foods be silently sabotaging not just waistlines, but reproductive health as well? A groundbreaking study suggests the answer is yes. Over the last half-century, global rates of obesity and type 2 diabetes have skyrocketed, while male fertility has taken a nosedive. Researchers have long suspected that ultra-processed foods, those highly engineered, shelf-stable products dominating grocery aisles, are partly to blame. Yet until now, scientists weren't entirely sure whether it was the ingredients themselves, the way the foods were processed, or simply the tendency for people to overeat them that caused harm. An international team of researchers recently uncovered some startling insights into this issue. Their findings reveal that individuals following an ultra-processed diet gained significantly more weight compared to those eating minimally processed foods, even when calorie intake was identical. Published in the journal Cell Metabolism, the study also highlights how diets rich in ultra-processed items expose the body to higher levels of harmful pollutants, which can negatively impact sperm quality. Our results confirm that ultra-processed foods damage both reproductive and metabolic health, even when consumed in moderation, explains Jessica Preston, the lead author of the study, who conducted her work during her PhD at the University of Copenhagen's NNF Center for Basic Metabolic Research, CBMR. This strongly indicates that it's the processing itself, not just overeating, that makes these foods detrimental. To ensure the most accurate results, the researchers designed a meticulous experiment comparing the effects of unprocessed versus ultra-processed diets on the same individuals. They enlisted 43 healthy men aged 20 to 35, each spending 3 weeks on each diet with a 3-month washout period in between. Half began with the ultra-processed diet, while the other half started with the unprocessed version. Additionally, half of the participants received extra daily calories, 500 more than needed, while the rest adhered to a normal caloric intake based on factors like age, size, and activity level. Importantly, neither group knew which diet they were assigned to. Both diets contained equal amounts of calories, protein, carbohydrates, and fats. The outcomes: men on the ultra-processed diet accumulated approximately 1 kilogram more fat mass than when they followed the unprocessed diet. Several markers related to cardiovascular health were also adversely affected. And this is the part most people miss. Ultra-processed foods aren't just empty calories. They're carriers of hidden dangers. The researchers found a significant rise in phthalate, CXMIM, a chemical used in plastics that disrupts hormones, among men eating ultra-processed meals. These men also experienced drops in testosterone and follicle-stimulating hormone, both of which play critical roles in sperm production. We were astounded by the extent to which ultra-processed foods disrupted multiple bodily functions, even in otherwise healthy young men, says Professor Romain Berez, the study's senior author from the University of Copenhagen's NNF Center for Basic Metabolic Research and the University Côte d'Azur. The potential long-term implications are deeply concerning and underscore the urgent need to reassess nutritional guidelines to better safeguard against chronic diseases. So what does all this mean for you? Should we rethink our reliance on packaged snacks, ready-made meals, and fast food? Is it time to prioritize whole, unprocessed foods, not just for weight management, but for overall well-being? We'd love to hear your thoughts. Do you think governments should impose stricter regulations on ultra-processed foods? Or do you believe personal responsibility is enough? Share your perspective in the comments below.